Why? Because this water will, if your medicine is still sitting in your stomach, and this water goes in, it will extract it out too fast. Yeah? So for medicine and for...
Okay, and one more thing. You talked about your friend's mother, right?
Yeah.
She was on a lot of antibiotics,
Yeah.
right?
Yeah.
So when you were giving water to her, her daughter was giving water to
Yeah.
her.
Yeah.
How it was like, because you were saying, right,
okay.
continuous IV things were going on. So
correct.
I'm sorry, I have a medical background, so that's why.
Sure, that's why you're asking the question. Yeah. You know how intravenously when you give antibiotics, you know what happens to the system. It kind of screws out the stomach. She was not eating, she was not able to do anything. So they couldn't control that aspect of it, but what they could control was just giving the water. So don't ask me how, I don't know how it worked, but just drinking a lot of this water allowed her to flush out a lot of this toxins and stuff out of the system, and she started sitting up. The very next day itself, she was up and talking and she was eating food. She still had the pain, and you can't take that away. Even months after that, you still have that ghost pain that you have in the leg. But she started healing much faster. Okay? So how it interfered with that antibiotic, I got no clue. Anyway, those antibiotics were given intravenously to her. So I don't know how the mechanism of it, how it worked. If it had been orally, I don't know how it would have worked either. Yeah.
I just want to give a short testimony about my husband. Last year he was diagnosed with colon cancer.
Colon cancer?
Yeah.
Okay.
And somebody gave us the water, okay, before he was diagnosed. Okay, after he was diagnosed with colon cancer, he went through surgery and it was stage 3. Of course, he was asked to go for chemo. But after asking the oncologist a few questions, he really didn't want to do the chemo. He has no confidence. And he asked the doctor whether it's a guarantee that it will cure his cancer. He said no, it's just reduce the chances of the relapse. And he said, you trying to use poison to try and treat my cancer? He said yes, but this cancer, I mean this poison may save your life. Then my husband said, let me go home and think about it. You don't need to think. After he talked with me all that, he told the oncologist no. When he went back to see the surgeon asked him why isn't he opting for chemo. He told the doctor that, oh no, he doesn't want any poison to go into his body, and he's drinking this water and having some supplement. Oh, he got a earful from the doctor. Okay, so when we came out, I told him, next time don't tell the doctor anything about Kangen water. But because he didn't opt for this chemo, every 3 months he has to go back and have to have a blood test to monitor his marker, cancer marker. But every time he goes back, it's 0.5 or 0.6 or 0.7. So after about 9 months, the doctor said, oh, Paul, that's my husband's name, you are doing very well. You know, if I were to send my blood for testing, my cancer marker may be 2 or 3, but you are doing so well, even below 1. What did you do? See, the doctor forgot what he had ever asked my husband this question, but he has seen so many patients, he forgot that my husband has actually answered his question. But the doctor's back was facing me. My husband was facing the doctor. When the doctor asked him, what did you do? My husband looked at me. I shook my head. The doctor looked at me. My head is straight. So anyway, last month, he has to go back for another colonoscopy after 1 year of surgery, you know, because the doctor said, we want to see whether it has spread. He went for a scan on his liver and stomach. It was clear. And during the colonoscopy, before that, he told the doctor not to sedate him because he wanted to see with his own eyes how his colon looked like. He invited me in. I said, no thanks, you know. But anyway, he said that during the colonoscopy, he saw with his own eyes, he seen the video of Shinya's, you know, different kind of colon. He said it was so pinkish and so healthy and looked so good, you know. So after that, he sat down in front of the doctor again, and the doctor said, oh, Paul, everything is fine. He said, in fact, I think you make the right choice in not going for chemo. So when my husband told me that, you know, on the way home, I keep thinking, you know, why did the doctor make that comment, you know? Then it just dawned on me. He must have seen the colon of those who have gone through chemo and this rare one that didn't go. He must have seen some difference. That's why he said that, you know. So I'm so happy, you know, and my husband is too, that our friend recommended us this machine. Alright, and of course, besides drinking lots of this water, he drinks about 4 liters. Okay, and he said his backache is gone, you know, disappeared. And of course, he's changed his diet. He followed as closely the Shinya's diet as possible. 80% vegetable, 20% protein. Out of the 80% vegetable, 40% is raw. And I'm so glad that this machine is able to remove all the pesticide from the vegetable. And because I also eat what he eats in the past, I say he's the first one to get cancer. I may be the next victim. So I'm also drinking lots of the water and eating, following his diet. Hoping, you know, and I believe that, you know, we are doing the right thing. Okay, that's all.
Thank you.
Yeah.
Thank you. That's an amazing testimony that she's given. Yeah. Sure.
Sorry, I'm coming up for so
No, it's okay. It's all right. I mean, if you're asking a question, it means that you are involved, you are engaged, and I like that.
Okay, so when you wash the vegetables
Yeah.
in this water,
Yeah.
and all the pesticides are gone, that means we should be buying organic, the normal one?
You wouldn't have to, yeah. You wouldn't have to. But okay, it's 2 levels, because in organic vegetables, in the fertilizers also they don't use that is chemical based. So sometimes the plant itself absorbs that. So this water won't be able to remove what the plant has already absorbed inside. But externally, every vegetable that comes to Singapore, or every fruit or whatever it is always sprayed with some sort of preservatives and pesticides. This water will have to remove all of them.
So kind of a wax removal.
Yeah,
apple.
Correct. Well, for apple it does remove. Grape is one of the toughest. I got to wash it like 10 times before the grape starts looking anywhere like a grape. Okay. Tomatoes, you saw what happened. Okay. Just to tell you a little bit. Like in answer to a question, I've got a friend who treated his mother-in-law in China who had 3rd stage oesophagus cancer, and she's almost like free of cancer, and the people are getting very excited. She saved herself. She's 85 years old, because the same time that she was diagnosed, there was another 55-year-old man in the same province who was diagnosed with also the same kind of cancer. Within three treatment of chemotherapy, he died. This woman is 85 years old. She went for 1 treatment, she decided, okay, no more, and then it so happened that the son-in-law was dutiful enough to go and buy this machine and give her all those things, and she's still alive, and she's very active, and the people around her are getting it to be so excited, and they want to buy this machine and stuff like that. Now, the main reason why we have that kind of cases, you know, with cancer and all that, as explained by even Dr. Carpenter or Dr. Shinya and all that, is that the modern medicine today in our healthcare system, we are only treating the symptom. The tumor is not the cancer, the tumor is a symptom of the cancer. You've got to go back and ask yourself, why is it that the cancer cells? From what I understand, when cancer survives or thrives on an acidic environment, you have cancer cells, I have cancer cells, every one of us have cancer cells. And in the natural run of things, our killer cells come up every time the cancer cells come up, and they keep them in check. They chop them down and they are alright. But when you create an environment which is very acidic, it's like feeding hay to fire, right? If cancer cells is like fire, suddenly you feed hay, they proliferate too much, a lot more, and that the natural killer cells cannot cope with that. And that's why you have cancer overwhelming. And you have this thing called mutation of the cells by an oxidative stress. Right? So now when you remove one aspect of treating cancer, seems to be removing that which gives cancer its power, right? Which is lack of oxygen and too much of acidity. But on the other side of it, you've got to do something else to boost up your natural killer cells. And of course in the market there's something called transfer factor and all those kind of stuff, which if you're interested you can find out about. But generally just stopping that the cause of cancer itself seems to be doing the work, because okay, this is what the company says. It says whenever you're talking and telling people, please don't say the water cures people. Please don't say the water cures people. Because the water doesn't cure people. Your body cures itself. The body has got everything it needs to cure itself, provided it gets the right amount of nutrients and whatever it needs. And this water seems to be providing that, the ability for the body to absorb the right amount of nutrients, the oxygen it needs, the hydration and all that. And now your cells are more alive. Your brain is sending a lot more signals all over the place, and it's curing itself. That's exactly what's happening. So I'm glad she gave the testimony. That was unsolicited. Thank you. What's your name again, please?
So Ying.
Sewing.
Sewing. Sounded like sewing. Oh
Yeah.
yes, I have another question.
Thank you, yes.
My friend, she's considering buying the machine. She said she had some eye problem.
Yeah.
Itchy and sometimes things like that. Just now I heard you say you spray 2.5
2.5, yeah.
into your eye?
Yeah.
And nothing?
Nothing will happen, don't worry.
Okay.
Because I had viral conjunctivitis.
Okay.
And viral conjunctivitis, I caught it in the beginning, still nothing can happen, right? It has to run its course. Eye was so painful, and I kept spraying this strong acid water into my eye. When I went for checkup and all that, they found, they said, oh, very good, there's no secondary infection. Because it was killing all the bacteria and stuff like that. And every time I sprayed it, you get a bit of relief, you know, with the
How about dry eyes?
How about dry eyes?
Acidic drink or dry
is very important.
Yeah, I don't know how.
11.5.
11.5
I have a friend
is
suggesting
better.
that I spray
Because
Okay.
our eyes are alkaline.
Okay.
So spray
The tears are
11.5.
alkaline.
Okay.
Yeah, I mean for
I don't know about that, but all I can tell you is spraying that strong acid water into my eye, which is very sensitive, nothing happened. In fact, it kept it from some additional bacterial infection, you know. So, and I've had that, I gargle, I've swallowed it, nothing happens to me, you know. I've sprayed it on my wounds, it heals up. In fact, it heals much faster externally. But don't drink the strong acid water. don't drink the strong acidic water and the strong alkaline water. Okay?
I don't feel comfortable to take medication like 1 hour later and take Kangen water because I think the medicine will stay in the stomach a couple of hours to digest, right?
The advice is minimum give yourself 1 hour after taking the medication. Even after eating food, give yourself 1 hour before drinking or taking this water. If you don't feel comfortable, you want to take 2-3 hours, then go ahead with it. I mean, you got to know your body. But so far I've done that, and touch wood, from the time I've taken this water and everything and my supplements, I've not seen a doctor and I've not been taking much medication at all. Whereas previously, see, I was the army where the young doctors at the drop of a hat they would prescribe antibiotics to you. And in the early days they never told you that you have to complete the complete course. So I used to take a lot of antibiotics and halfway drop it off. As a result, I became immune to 3/4 of the antibiotics, and every time they have to give me 2 or 3 doses and stronger and stronger. Enough of all of that, and I've decided that I will not do it. So I've gone this way. That's one of the reasons why I've done a lot more of this research and stuff like that. So do what feels naturally. You know? We are not here to tell you what is right or wrong, but that's the advice. Okay? Thank you. Thank you for your attendance. You've been a good audience. Thank you. Bye-bye.
Penny, you're back. Yeah, I was in Hong Kong last week. This Friday I had
Again?